Hi guys, this is Dr. Puja. I'm a board-certified family medicine physician, and today we're going to review SOMI's nighttime skincare routine. I'm going to tell you what she did right, I'm going to tell you what she did wrong, so that way you don't make the same mistakes. We're going to talk about acne, we're going to talk about hyperpigmentation, and we're going to talk about actives such as hyaluronic acid, and we're going to talk about the importance of having a good moisturizer in your skincare routine. Yep, so she's absolutely correct. I mean, you need a good moisturizer. SOMI here has really dry skin and she wants to use a good moisturizer because she has dry skin. What I want you to know is that I don't care what kind of skin you have. Like, for example, you could have dry skin, you could have oily skin. Either way, you're gonna need a good moisturizer because a good moisturizer is gonna help strengthen your skin's natural protective barrier. The reason that's important is because if you have a weakened barrier, your skin's gonna become sensitive, inflamed, red, irritated all the time. And it also then can increase the likelihood of you developing acne, pimples, zits, and infections, and just this chronic state of inflammation. The stretchy feeling that she's talking about that she doesn't really like is actually a feeling that a lot of my patients love. Your skin should not feel like that after you cleanse it, because if it does, you've actually stripped it of its natural moisturizers. You've stripped it of its natural oils. If that occurs, you then are, again, going to impair your skin's natural barrier, and that, again, is going to result in more inflammation. So a lot of times, if you catch yourself feeling like that, you want to make sure and really investigate and see if that's the right moisturizer or if that's the right cleanser for you.
Moisturizing is key number one. I have my eyelashes on, so I'm using Etude House lip and eye remover, so it works very well.
So the way that SOMI is removing her eye makeup, and she admits to it, she's not that gentle when she does it. Being gentle on your skin is actually a really important thing when it comes to achieving your optimal skincare. It's really going to allow you to receive the best outcome from your skincare routine. And the reason is, if you are not being gentle when you're cleansing your skin or when you're drying your face after you've washed it, because you're going to, again, impair your skin's natural barrier, and that in itself can cause additional skin problems. The other thing is just chronic friction, so rubbing the skin around your lips or the skin around your eyes over time can result in friction-induced hyperpigmentation, which basically are dark spots, so discoloration of your skin in those areas. So super important to be really gentle. Okay, so she's using a oil-based cleanser, which is something that you may be familiar with, the method of double cleansing. Is it a good method? Yep, it's a good method so long as you're following up your first cleanser with a second cleanser. So as long as you're actually doing a double cleanse. So what exactly is a double cleanse? A double cleanse is you're gonna use two cleansers. The first is a oil-based cleanser, and then the second is a water-based cleanser. People that have oily skin or people that wear a lot of makeup will, without a doubt, benefit from a oil-based cleanser. Just make sure that that oil-based cleanser that you're using is using a non-comedogenic type of an oil. And then I can't figure out what type of oil is in this product. It's really not listed on the website, but it has hyaluronic acid in it, and hyaluronic acid is a good active to have in your cleansers. A hyaluronic acid molecule basically will allow your skin to feel a little bit more hydrated and a little bit more plump. So it's gonna really minimize that dry, irritated feeling. I mean, yeah, so she's right. She isn't gonna get that super stretchy feeling of her skin like after cleansing it because she's using a oil-based cleanser. You can use a really gentle cleanser like CeraVe's gentle skin cleanser. It has hyaluronic acid in it. It has a few ceramides in it. It doesn't have any mineral oil in it, so it's a water-based cleanser that can also minimize the feeling of just being over-dried and that feeling of where you've stripped your skin's natural oil. So you don't always have to have or use an oil-based cleanser to really prevent that.
It's like massagers.
So the technique that she's using right now is just a whole lot of hot air. You don't need to do that to your face. You don't need to massage it or stroke it in that fashion in order for any of the products to really get in. Yeah, it's going to cause more redness to the skin because you're literally just moving the tissue around. This technique, comes from the myth or the idea that, well, if we're moving our tissue around, we're increasing the blood flow to our skin. And if you're increasing the blood flow to our skin, then that tissue is going to heal better, or you're then going to be able to absorb all of the products that you're using. I mean, it's just a lot of hot air. You don't need to do it.
I used to go see a dermatologist a lot and get facials done or stuff like that. But these days, I really don't. Pajamas or rinsing. I'm gonna use my towel.
Oh, good. So I really liked the way that she's pat drying her face. That technique is impeccable. It's something that you should try to replicate if you are not already doing. She looks essentially the same with or without makeup.
Okay, so now it's my skincare routine. What do? I use a toner at first. I bought my coffee.
Okay, so there's a lot of controversy about toners. Do you really need a toner? No, you don't really need a toner. Toners really came into play many years ago because the way that soaps were formulated back in the day were that they had a basic property to them. So our skin's natural pH is acidic. Soaps used to be very basic. And the thought is that, well, when you washed your skin with a very basic type of soap, you then would impair your skin's natural barrier because in addition to having good hydration, good natural oils, it also needs to be at a certain pH. So the idea is that, okay, well, we've stripped off our skin's natural acidic level by using this aggressive soap, and now we need to put a toner on our face to bring it back to normal physiological pH. I mean, yeah, that used to be true back in the day. It's really not necessary anymore. So you can technically skip that step. There are a few caveats here because there are certain skin conditions such as acne or eczema where the person's natural pH is already off, meaning that it's not as acidic as it should be. And then if you're cleansing your face aggressively, or if you're using a pore moisturizer, or if you're aggressively towel drying your face, then you can theoretically impair and change your skin's natural pH, and then those people may benefit from a toner. It's always important to speak to your doctor about your pH, especially for using any types of prescription medications. For example, benzoyl peroxide, which is a very common medication for acne. It's found in a lot of over-the-counter, products. Works really best if your skin's pH is less than 5.5. So, technically a pH of 5.5 is within the acidic range, but if your skin is just a little bit above that, if the skin's pH is just a little bit above that, which might be the case only if you have acne or if you're aggressively cleansing it, that benzoyl peroxide might not effectively, battle your acne. So it's always important to speak to your physician as well about using a toner. But generally, there's really no need for a toner if you're using a gentle cleanser and you're not just aggressively affecting your skin's natural barrier. So she's literally like clapping her face and like tapping her face. You don't need to do that. Again, that is another technique that's just going to temporarily, cause redness to your face. It's really not going to cause the products to get deeper into your skin. There's no need for that. So if you don't know, an essence is basically the same thing as serums. So a serum is something that you put on your face that has an active ingredient on the skin that will result in certain changes. So for example, hyaluronic acid is like a common active that we all know about. The purpose of hyaluronic acid is that it's going to help with the hydration, the plumping effect of our skin. So essences are traditionally Korean-based products where they don't have as much of the same amount of concentration as serums that are sold in the United States. So the theory behind it is like they're just a little bit gentler, but they're not as strong because the concentration is less. Do you need an essence? No, not really. Do you even need a serum? No, not really. But it's good to know the difference between the two. The reason it's good to know the difference between the two is because you then don't want to use multiple actives or multiple essences or serums at the same time, because if your skin then starts to react, you might not know what's really causing the issue. And a lot of, actives at the same time can again impair that skin's natural barrier, can cause a lot of other irritations and just this chronic continual state of inflammation. So my philosophy and, even the evidence behind it is you want to try to really minimize the use of a lot of actives and a lot of serums. It takes our skin about 30 days or so to turn over. So the idea is that give yourself about that much time to see if this ingredient or product is really doing anything. People that have eczema, people that have psoriasis, people that have acne, people that have a lot of photo damage, their skin turnover cycle lasts a little bit longer. So it's like 45 days or so. So again, that 30 days is not like a rule that's written in stone. So she's correct. I mean, using a good skincare routine, using really good quality products can actually prevent wrinkles. They can preserve your collagen. They can even help plump up your collagen. So every, skincare routine that's out there, if it's the right skincare routine, it's not gimmicky. It can actually prevent wrinkles and aging. So far, she hasn't really used any products that are technically evidence-based when it comes to anti-aging. They're all basically just ingredients that are increasing moisture in her skin. So it's giving her the appearance that her skin is like, nice and plump. And then that might diminish any thin lines or fine lines. But there's really no active or medicine that she's using that's really going to cause a improvement in the amount of collagen that's on her skin. She's on her 7th step. You don't need 7 steps. So the next product that she's using sounds very gimmicky. I mean, the idea behind this is that there's oxygen in the product. So you're gonna put oxygen on your skin and that's gonna help prevent wrinkling. It's going to prevent any skin damage, or it's going to repair your skin damage, because apparently they think that oxygen's serving as an antioxidant. That's a bunch of BS. You don't need to waste your money on that.
hydration and oxygen. So important.
So this is probably one of the biggest myths that exist in skincare. A person will tell you, hey, I'm gonna use these 30 products and these 30 products work for me because my skin type is different than your skin type, or this esthetician or this person is telling me to use all of these products because they know my skin type. That's a bunch of BS. It's true. We all have different skin types. We all have different needs. But again, at the end of the day, there is a range that is known to physicians. There is a range of what's normal and what's abnormal. Yes, there are going to be variations that are outside of those ranges. For the larger picture, don't believe somebody if they're like, hey, I know your skin type, so you're going to need this product. That's just a bunch of BS. Okay, so the next product that she's using is like a mole cream. That's what it's called. So the good thing about this product is that it has squalene in it. Squalene is a molecule. It's found in a lot of cosmeceuticals. It's actually a really good molecule. You don't have to spend $100 to get this molecule. Squalene is a non-comedogenic type of an emollient. What that means is it is a product that's going to help hydrate your skin. It's going to make the top layer of your skin look really nice and shiny, and it's going to look like you have this natural glow coming from within. It's found in simple moisturizers. It's found in simple products that you can just get for like $5–10. Like The Ordinary has a really good squalene product. The good thing about this is it's very non-comedogenic, so it's not really gonna clog your pores or cause any type of acne. But stay away from a product that's like $150. So yeah, the squalene molecule is going to give you a limited amount of hydration. Once that molecule is degraded by your skin then isn't going to be able to maintain that moisture by itself. So it's really not causing any type of long sustaining anti-aging properties to it. It's literally just plumping up the skin for the time frame that it's on your skin. So that plumpy feeling that she's describing as she like smacks her face here is the molecule squalene that's kind of sucked up all of the moisture, and it's giving her that plump effect. And the last product that she uses in her skincare is just, again, is a lot of BS. It has oxygen in it, apparently, and it's supposed to make your skin healthier because it's delivering oxygen right into the skin. I don't even know if that's gonna absorb in the skin. Even if it does, like, it's not gonna do anything. Again, you don't need to waste your money. These products really are not going to do much for you. They may have a temporizing effect, but I mean, they're not really going to have any type of anti-aging effects to them. And then next, she uses some face toning tools, like literally like exercise toning tools. I'll talk about those on my next video. I hope you had fun. I had a lot of fun making this video, and I will talk to you later. Bye.